This presentation is brought to you by the SDG Decision Education Center.
Hello everybody and welcome to today's webinar, The Importance of Portfolio Strategy in an Era of Real-Time Portfolio Management. And now I would like to introduce today's speakers. Our first speaker is Deepak Veeraraghavan. Deepak is based in SDG's Düsseldorf office, where he leads the firm's global life science practice, as well as the strategy consulting practice in Europe. He has led client teams in strategy development, portfolio management, change management, and decision process design. Recently, he's been working with pharmaceutical companies to implement portfolio prioritization methodology. Deepak, welcome to today's webinar. And I think you're muted at the moment, Deepak, and William, if you could make sure you're unmuted. Thank you. Also with us today is William Leaf-Herman, an SDG partner and leader of the firm's North American life science practice. William has 25 years of experience in structuring and developing corporate, therapeutic, product and portfolio strategies for clients in the pharmaceutical and biotech industries. William, welcome to today's webinar.
Thank you, Jill. I'm looking forward to it.
Thank you. And finally, I'd like to introduce Florian Methling, a consultant in SDG's Düsseldorf office. Florian will be answering some of the questions you submit today using the question panel and passing some of the questions along for us to answer at the end of the webinar as time allows. Florian, welcome.
Thank you, Jill.
So without further ado, I will be handing over now to our first presenter, Deepak.
Thank you, Jill. Portfolio management is a topic that's of interest in many industries. When you have more than a couple of assets to invest in, and you're looking to actively take decisions around those investments, you're already managing the portfolio. The relevance to portfolio management, as we are going to see today, is in a number of industries. To start with, life sciences. In life sciences, a portfolio is a combination of assets and indications. These assets are applications in multiple indications, some of them that are in market and some of them are still under development. And the companies look to make these sort of decisions around what level of development, what to develop, when to develop, etc. Challenge in life sciences with respect to portfolio management is about actively guiding these asset level decisions to maximize the overall value of the portfolio, considering the risks and the constraints. And we're going to talk in more detail about the life sciences example today. In energy, you have a number of companies which have a wide variety of solutions and offerings, and they are looking to actively manage this portfolio of products and services. The challenge today in energy transition is to think about what is the balance of these opportunities that they want to have in their portfolio. You have a portfolio that's filled with older technologies, and you have a bunch of new technologies that are coming up on the horizon, and thinking about what are the right capabilities to invest in, what are the right technologies to bet on for the future. In finance, portfolio management basically means investment in different types of assets. And the management of portfolio in finance is actually much more detailed and much more frequent. Single events can dramatically shift the portfolio focus. Something like a monetary policy change by ECB, the Ukrainian war, many of those things have a huge impact on the financial portfolio. And the portfolio management is about trying to have a good balance and trying to think about the portfolio focus as these things evolve. Now, before we go into the topic, I would like to understand more about the interest that you have in today's webinar. Jill, let's go to a poll. So, what is your interest in today's webinar? Do you work in pharma in portfolio management? Do you work in portfolio management but outside of pharma? Or are you generally interested in portfolio management as a topic? Or are you also looking at different applications of decision sciences? If you are not falling into any of the top four, if there's something else that is interesting for you today, we would like to know more. And there is question box. So please enter your, if you're choosing number 5, we would be interested in hearing more about your interest. This is not public. This is something that only we will know, and that will be of interest to us. I see that we have a number of you who have already voted. Thank you. So it's a good mix of people today. It's nice to see a lot of people focused on pharma portfolio management, but it's also good to see people interested in portfolio management in general. While we would talk about the portfolio management with the focus on pharma, the methodology and the framework that we would address can be used in different contexts. So I hope you take something that's relevant and interesting for you at the end of today's webinar. Let's move to the next slide. One more quick poll. What describes your interest in today's webinar? Jill, if you can answer, start the poll. Are you? Okay. So how does your company approach portfolio management? That's the actual question. So does your company use real-time or even event-driven portfolio management? Do you manage a portfolio episodically, meaning you have a portfolio review that your company does twice or thrice a year? Do you have a portfolio of assets but no formal review process? Or probably a company doesn't need portfolio management because you have 1 or 2 assets. As you're voting, William, in your experience, what has been the kind of portfolio management that you have seen companies use?
Thank you, Deepak. I've seen increasing interest in event-driven or real-time portfolio management, primarily to achieve agility in an ever-changing marketplace. So I think increasingly that is where companies are focusing their efforts of improvement.
Thank you, William. I see that people are still voting. So if you haven't selected an option, press submit. Now is the time. I would give it a couple of seconds more. And Jill, let's close the poll and show the results. This is very interesting, and contrary to what William said, a lot of companies are still working on episodic portfolio review a few times a year, and there is an increasing movement towards real time, but it's not as much, at least amongst this audience. Let's move back to the slides. So companies are investing in these capabilities, and there are a number of approaches. So the first 2 on the left side talk about these episodic portfolio reviews. Companies may have quantitative approaches, like a discounted cash flow model, looking at different financial metrics and trying to create and compare R&D productivity using efficient frontier and other tools. Companies may also use qualitative approaches like a heat map where you have specific portfolio attributes. In the case of life sciences, they may look at which disease areas they are in, which geographies, what's the risk level, what stage the assets are in, etc. There is a move towards real-time monitoring or even event-driven programming, event-driven portfolio management, where there is more like a dashboard and looking at different benchmarks and using those two to compare portfolio analytics. While these are very good approaches, let me give you an analogy. Let's say you are driving a car and you want to reach a certain destination. A portfolio management, be it real-time or event-driven portfolio management software or tools or the process, is like the dashboard in the car. It's nice to look at it. It gives you a good sense of where you are in the moment. It helps you navigate the road that you're on. But the goal is something that you need to set. And that's where the portfolio management needs to be complemented by portfolio strategy. So some of the limitations that you have with the current portfolio management approach is it's based on available data and historical benchmarks. The calibrated judgment, expert judgment, is not consistently used. The other issue that we have seen consistently is the portfolio that a company has is a consequence of a number of steps that they have taken, but there is always a single portfolio. And in portfolio reviews, you evaluate individual assets, and there is not a systemic consideration of different portfolio alternatives. As a result, you end up with an advocacy process advocating for specific assets because there is no overarching portfolio strategy alternatives. The last point, event-driven approaches typically are a reaction to something that has happened either in the marketplace or in the clinical trials or with the asset. And so you're reacting to an external event and you're not doing a proactive strategic guidance. So in our opinion, the real-time portfolio management is a very powerful tool, but it's not a substitute for a clear forward-looking strategy. Let me do a quick thought exercise. I'm going to give you a few parameters for each of the two portfolios. And as I'm going through these parameters, I would like you to think about, with the information that you have, which portfolio would you invest in? As a portfolio A or portfolio B? So let's say portfolio A has an NPV of 2.5 billion and portfolio B has an NPV of 2 billion. Which one would you invest in? Think about this. I'm going to also share with you our results when we ran this exercise a few times. Most of the people would have chosen portfolio A or chose portfolio A because it has a higher NPV. And that is something that people are comfortable with. Let me give you one more piece of information. Investment costs. Let's say portfolio A has an investment cost of 15 billion and portfolio B is about 9.5 billion. What would you choose? Mark it for yourself. When we ran this exercise, people actually shifted to portfolio B. Even though ideally investment cost is included in the calculation of NPV, the fact that portfolio B had a lower cost made it less risky for the majority. Let me give you one more. The number of assets. Portfolio A has 25 assets and portfolio B has 10. What would you choose? In our experience, we found that people shifted back to portfolio A because there are a larger number of assets and there is a higher chance some of them could be more blockbusters. So that was, but again, it's not a clear cut as is the case with NPV. Let me give you one more. VAR stands for value at risk. So 85% VAR means that there is a 15% probability that the portfolio A will lose 10 billion or more, which means there is an 85% probability that the portfolio A would lose 10 billion or less. So it's basically portfolio A has a much higher value at risk compared to portfolio B. What would you choose now? In our experience, people dramatically shifted to portfolio B because the value at risk is much higher in portfolio B. Let me shy away from these financial numbers. Let me pick up a couple of qualitative dimensions. Technology. Let's say portfolio A is disruptive and portfolio B is conventional. Would you still consider portfolio B or would you shift to portfolio A? In our experience, people again moved up because disruptive technologies were seen as the path to the future, and that kind of helped people, at least some people, move to the left. The last one, market focus. Portfolio A operates in geographies and markets that are out of strategy for this company, and portfolio B operates in markets that are in strategy. So even with this example, 60% chose portfolio B and portfolio A. And we had to make people choose one of these two, and there wasn't a third option. There were a number of people by the end of this who weren't really sure which one to choose. And you can think of enough and more such dimensions. The point of this exercise is evaluating portfolios is difficult, and it depends on a number of factors. And portfolio management helps you with that, but it's good to have a clear portfolio strategy. And to talk more about the distinctions between portfolio strategy and portfolio management, I invite William.
We do work in both portfolio management as well as portfolio strategy development, and clients sometimes ask us what's the difference between the two. And we think of it in terms of 4 differences across 4 key dimensions. One is the portfolio scope. How do you define the portfolio that you're talking about, whether you're managing it or you're developing a strategy around it? The second is investment focus. What type of investments are you making? A third is the time horizon. Are you looking at investments that you'll be making over fairly short term, 1 to 3 years, or over a much longer time period? And the fourth is sort of the number of alternatives that you need to consider. This has implications both in terms of the amount of data, the type of analytics that you apply to it. So if we're looking back at portfolio scope, typically portfolio management is fairly well defined around a narrow set of assets. It could be just those in development only. When you turn to portfolio strategy, oftentimes your scope expands. You might also be considering projects that are deeper in the pipeline and research. You might also be looking at opportunities outside of your current portfolio, so potential BD investments. So typically, the way you're thinking about the portfolio differs from management versus strategy. In terms of investment focus, typically in management, there's a few number of constraints. It could be the development budget, it could be a manufacturing constraint that you're dealing with, whereas in portfolio strategy, typically it's more complicated. You might be looking at multiple functional budgets, also investing in capabilities or alliances. So there, it's going to be much more determined by the business issues that you need to face as opposed to an internal business process. Time horizon, I already mentioned that the investments in portfolio management, although you need to understand the value over a long period of time to make those investments, but typically they're investments that in life sciences are tied to the length of clinical trials, typically 1 to 3 years before you get new information and move to the next stage of development. When you're dealing with portfolio strategy, it's much longer term, oftentimes 5 to 10 years. So there you're also thinking about what goals, what type of company do we want to be in a decade, and what's the strategy to get us there. And I mentioned alternatives. It may seem that there might be more alternatives on the portfolio strategy side, but actually the on portfolio management, if you just had 4 assets, each with 2 alternatives, that would lead you to 2 to the 4th potential investment alternatives in your portfolio, or 16. In practice, it turns out that there's typically only a fairly small number, typically 3 to 5 strategically distinct, compelling alternatives that that need to be evaluated at the end when you get to that stage of the process. So although portfolio management and strategy are different, they're definitely connected. The left-hand side shows a hierarchy that ranges from corporate strategy at the top all the way down to asset level strategy and portfolio management at the bottom. And we think of portfolio strategy as really being the link between the corporate vision, the corporate strategy, and the portfolio that you're managing and the investments that you're making at the asset level. Corporate strategy, it really answers, what are we going to do? It defines the elements of the value chain that the company should occupy, the business that they're going to be in. Are you going to be in diagnostics, devices, consumer healthcare? Those are typically issues that are addressed at a corporate level. Also, the long-term objectives and goals of the company are set by that corporate strategy. The portfolio strategy really tells us, how are we going to do it? How are we going to deliver on those goals and objectives? And it typically involves what therapeutic areas or disease segments are we going to be investing in? How do we invest across them? What capabilities, what platform technologies might we need to win in these markets? And then finally, we think of portfolio management as the activity to make sure it gets done. You're typically, whether you're doing it in real time or episodically, you're checking in to make sure that your investments across the portfolio are creating value. At the same time, you're going to be actively managing resource constraints as well as risks, both technical risks involved in development as well as commercial risks from new competitors entering the market. The better the alignment you have across these 3 levels, the better the chance that your company will achieve its goals and win in the marketplace. Some companies take a hypothesis-based approach to strategy development, but at SDG, we've developed a new approach to developing portfolio strategy, which incorporates the best practices from several key decision areas: decision sciences, innovation and systems thinking, and change management. We've laid out the 4 steps here. I'll talk through them. I do want to alert you that although each of these chevrons is of equal size, the amount of time and effort for the first 3 chevrons is just a few % of the total effort that you would spend across all 4. The vast majority of the time and effort is in step 4, but getting those first 3 steps right gives you tremendous leverage to achieve your goals and set you up for successful implementation. The first step is really all about framing the business issues and assessing your current situation. By framing, I mean understanding, first of all, what's given. What are the corporate goals and objectives that you need to achieve? What are the metrics that you're going to be using to determine what the best path forward? And then also, it's critical at this stage to think consciously about the scope of decisions that need to be made. If they're defined too broadly, then the problem becomes intractable. If you define them too narrowly, then you find yourself, you may have to be revisiting your strategy in less than a year due to changes in the marketplace. The assessment step here really involves both thinking about your own company and your current capabilities, but also looking outside, understanding where the competition is going, what capabilities they have, what investments are they making, as well as where the overall market is going. The second step is an expansive exercise. It's really the one that differentiates the approach. It's thinking through, taking your decisions and thinking, what are the organizing your information gathering and analysis around what you can do. Typically, this involves bringing multiple perspectives together across the business. You may even be looking outside of your company to seek expert perspective on new markets or the competition. And typically, this is where you may wind up with basically on the order of 3 to 5 compelling strategies. Sometimes these different strategies are oriented around achieving different aspects of the corporate goals. Because there's often, as Deepak, in the example Deepak provided, oftentimes companies have to make trade-offs between not only financial metrics, but factors such as risk tolerance, the level of innovation that they're willing to pursue. Many times we use a strategy table. It's a useful tool that we won't go into detail in this conversation, but that's a framework that allows us to make sure that these strategies are clearly defined and also that they span all aspects, all the relevant aspects of the business. The third step, evaluation, this is where you need to analyze the trade-offs across those alternatives. Occasionally, it may be clear that one of the strategies is dominant, that it's clearly a preferred alternative, but that's frankly seldom the case. Typically, it does involve some evaluation to think about value, risk, the level of investment, the time required to execute each of the alternatives. They'll typically be different across those alternatives. That creates trade-offs. While different perspectives are critical in actually getting a creative set of different strategic alternatives, the evaluation is more of a conclusive exercise. The goal here is to understand the sources of value and risk and build alignment around what the best path is for the organization. And then finally, the big step is, of course, implementation, starting with implementation planning, and that involves making sure that the right people are involved in the right way as you develop the process, as you develop the strategy. So although we put that in the last chevron, it's actually critical to also think about that right when you're framing in the first step to make sure you've got the right individuals who will probably be responsible for leading that implementation in the process. Let's turn to an example of each of these steps, and I'll be drawing on a life sciences example. Here's a sample of a decision hierarchy. On the left-hand side, in this pyramid, we have the givens, which are adopted from the corporate strategy. There's the strategic decisions, those which are the focus, and then there are the tactics, those decisions which we need to make later. Typically, the type of decisions that we'll be focusing on in a portfolio strategy are, what are our target markets? What disease states or areas should we be going in? What products, technologies should we be investing in? What geographies should we be pursuing? Oftentimes, one of the typical questions that may come up and be resolved through a portfolio strategy is, should we enter a new therapeutic area or not? And that would be an example of one of these key decisions. There's also, it could be aspects around the business design. What's who are our target customers? Are we focusing on specialists only? Are we going to need to build out a primary care sales force and associated capabilities? What's the distribution model? Organizational issues are sometimes important. Should we organize the business in a regional framework or use a global structure? Oftentimes this is may be defined, it may be more tactical in nature, but sometimes that needs to be resolved as part of the strategy. And then finally, which capabilities and competencies are we going to invest in? Not only internally, in terms of platform technologies that we may acquire or license, but also partnerships and alliances. In addition to these factors which are under our control, we also need to understand the market and how it's evolving. Here I've shared some of the issues that clients have raised with us as they assess their portfolio strategies. One is the introduction of interchangeable biosimilars. In 2001, the FDA approved two interchangeable biosimilars, one being Saltezo, a biosimilar for Humira, for AbbVie's Humira, adalimumab, and this has some profound implications for companies, whether you're in large molecules or not. The interchangeable nature means that essentially the pharmacist can substitute a biosimilar, in this case Saltezo, without consulting a prescriber. So this is a significant threat to the profitability of biological therapies, because oftentimes they were viewed as having a much longer tail of revenue because of the challenge of being replaced by biosimilars. Now payers have an opportunity to influence more directly the type of large biological that a patient might receive. It also opens up interesting opportunities for new therapies, though, in development, because now, as you think about the cost of a biosimilar or a biological component of the therapy dropping in price, it creates a better value proposition for combinations with those therapies. Others challenges are new technologies, biomolecular platforms, digital health, artificial intelligence and machine learning. Each of these create implications, both challenges as well as risks and opportunities that our clients have to think through. When a life sciences company is developing its portfolio strategy over the next, say 5 to 10 years, the real value of the approach that we're describing today arises from thinking creatively across the disease-oriented therapy areas and new platform capabilities. The only way these technology platforms, be they cell therapies, digital health, artificial intelligence and machine learning, are going to create value is by applying them in new therapies that meet unmet needs in the marketplace and create value for our customers. Let me turn it over to Deepak to talk about how to evaluate these different alternatives.
Thank you, William. So we have turned to multi-objective decision-making framework to evaluate these portfolio strategy alternatives. We are going to do that in combination with traditional financial evaluation. The reason is that this lends itself very well in a situation where you have multiple criteria. This is a 4-step process. The first step is to look at the objectives, thinking about the frame. So going back to step 1 of this process where we talked about the frame, we want to identify the objectives that are important from a portfolio strategy perspective. So these could be things like investing in attractive markets, increasing contribution to society, level of innovation, and so on. The idea is that we come up with a clear set of objectives that are in line with the portfolio strategy. The next step is to then develop scales for each of these objectives. And the scales are the way to actually evaluate alternatives. So each strategy alternative that we talked about in step 2 gets assessed on these clear scales. Once we have the scales, we want to have a clear understanding of the weights of these objectives that is defined in 1. So, for example, here is two specific objectives, innovation and capabilities, which are listed 4 and 5 in the set of objectives. The way to actually have a weights conversation with the decision makers is to think of different portfolios. So let's say the green portfolio on the right is consisting mostly of highly innovative technology like CNGT, where the company doesn't have capabilities to build. So the green point is high on innovation and low on capabilities. The orange point represents another portfolio where you're looking at mostly conventional technology like small molecules, but you have a lot of in-house expertise already. So we can think of different portfolios and have a conversation about what would be an equivalent. In this case, the green portfolio is equivalent to the orange portfolio in the minds of the decision maker, which means the decision maker views innovation twice as more important than the capabilities. So this kind of gives you clear weights on the individual objectives. Once we have the weights on the scales, it is a question of simple math to assess the individual portfolio alternatives to then come up with a score. So on the left, you see an illustration of 3 portfolios. The portfolio A is in green, portfolio B is in orange, and portfolio C is in this gray color. You can see that based on the multi-objective decision-making approach, these portfolios rank differently along 3 dimensions. And overall, the portfolio C ranks lower compared to the other portfolios. That helps you filter out some of the portfolio strategy alternatives that don't add much value, that are not in line with the different dimensions of the portfolio strategy. Once you have filtered out the portfolios and you have just a couple of portfolio alternatives that you want to evaluate, you then get to look at the financial metrics. These could be something like sales in 10 years. It could be a short-term cash outflow if you are resource constrained. It could be a specific sales goal that you want to address, or it could be an NPV. It could be a number of financial metrics that are relevant for decision making. And you use this to then agree on a specific portfolio strategy alternative that's applicable for you. As you are looking to do this, there are several key ingredients that are critical for a successful implementation of this approach, and I'm going to highlight a few of them. The first and foremost is to involve the right set of people in the process. Often in our experience, we have found that the commercial perspective is missing during the development process. The commercial perspective is more added as an afterthought late into the decision-making process, and that has profound implications. So it is important to involve and incorporate the commercial perspective early on during the process. Similarly, people who are going to implement the strategy need to also be involved. The second drawback that we have found in portfolio management processes and portfolio strategy development is a lack of clear focus on decisions. Earlier, most of the audience here said they are involved, they are with a company that does portfolio reviews episodically. If you go back and look at what happened to those portfolio reviews, we have found that there is no clear decision that's made at a portfolio level, but rather the decisions are done during the course of the year at an individual asset level. So the portfolio review is just a status check rather than a clear decision point. So there needs to be a mind shift and a change and a focus on decisions. One way to look at that is think about how are competitors approaching this market? What choices are they making? And is our portfolio similar to the competitor's portfolio? What else can be done to create strategy alternatives? The third aspect I want to talk about is the evaluation approach. If you go back and look at our approach, we created this set of objectives based on the need of the current company and the current situation. So the idea is to orient it around the criteria on which the decisions and trade-offs are made rather than trying to fit the portfolio to what you want. Use of this multi-objective analysis linked to a cash flow financial metric is very helpful. And last, the strategy robustness check is essential. At the end of the exercise, you may have come up with a set of weights. How do you know those weights are robust? So it could be easy thing to check, change the weights. So play around with the weights to see how sensitive is the final portfolio strategy alternative that you've chosen to the overall weights. If people have a different view on what is more important, does that change? If the strategy changes, the chosen strategy changes, then you may want to think about what aspect that's important and think about contingency plans. So these ingredients are essential to have a successful implementation. In summary, the portfolio management needs to be aligned with the portfolio strategy and they form a cycle. Portfolio strategy feeds into portfolio management and vice versa. William, do you want to add something to this?
I just want to emphasize that both portfolio management and portfolio strategy are critical to business success. The portfolio management, oftentimes one of the issues that arise in the course of reviewing on an episodic basis are gaps in the portfolio. And those typically cannot be, you might be able to bend the curve a bit in your portfolio in terms of revenue, but seldom are you able to completely close the gap. And that's a signal that you need to reconsider your portfolio strategy.
Thank you. That's the end of the presentation. We're almost time. Probably we may have time for one or two questions. Jill, do we have any questions?
We do indeed. Thank you very much, gentlemen, for an informative presentation there. First question, we have a question here from the audience, and it is, what is your rationale for not going with a hypothesis portfolio approach, but rather the decision science way? Do you see any drawbacks using the hypothesis approach?
I'd be happy to answer that, Jill. So the hypothesis-based approach, and I'm a former scientist, trained as a scientist, is a very powerful way to efficiently answer questions. The approach that we've outlined is efficient in a different way. It's oriented around decisions and alternatives and orienting the information gathering and analysis to inform decision making, as opposed to creating hypotheses and then determining, trying to prove them or disprove them.
Thank you very much. And I think, gentlemen, we could just fit one last question in. The next question is, where in developing the portfolio strategy, and I think it was slide 10, are the uncertainties considered and managed?
I can probably answer that. It is done in the evaluation stage. And when you look at the two approaches that we talked about, the multi-objective approach and the financial evaluation, In the financial model that we would build, uncertainties are explicitly captured. You can also capture the uncertainties in the multi-objective approach as well. There are a couple of ways in doing that. We can think about explicitly modeling the uncertainties in the scales that we develop. We can also do a sensitivity analysis on the weights and vary them to see if the decisions change, if the chosen alternative changes. So there are a couple of ways in which uncertainty can be built into the multi-objective approach as well.
Thank you very much. So that is all the time that we do have for today. So it just leaves it to me to thank you, Deepak and William, for your wonderful presentations. And just to let the audience know, if we didn't get to your question, we didn't have a lot of time, our speakers have kindly agreed to look over all of today's questions, and we will answer them via email in the next day or two.